Hi, I'm Elle Wadsworth and I'm a PhD student.
Hi, I'm Dave Hammond, a professor in the School of Public Health at the University of Waterloo.
On October the 17th, 2018, non-medical cannabis will be legalized in Canada, only the second country in the world to do so. In order to capture the Canadian policy experience, we have interviewed many stakeholders across the country prior to legalization.
The series will cover how cannabis will be regulated, changes in the cannabis industry, and why Canada legalized cannabis in the first place.
So medical cannabis dispensaries are the last piece within the customer-patient experience. Unfortunately, right now, as it stands, patients who are looking at getting treatment through the licensed producer system in Canada federally only can do so through mail order. And there are many issues within that because it's not providing readily available access. Just like how you or I, if we were in need, we can go to a pharmacy to get medication or a doctor. Medical patients, unfortunately, would have to wait for the post. And unfortunately, if your health is on the line, that's unacceptable. So medicinal dispensaries are really trying to provide that access for when patients need it, and then provide the education that cannabis is and can be used and should be used to treat a lot of ailments that right now we're using prescriptions or non-plant-based medicines for. So we've been really pushing and advocating for that since 2011 when we started out in Vancouver's downtown east side, which is a area very much hard hit with a lack of opportunity. We really saw that being in areas that are to some degree more vulnerable has actually allowed for there to be more community support in regards to what we're doing through our programs, and then as well it allowed us the opportunity to kind of uplift others in the community who didn't necessarily feel that their needs were being met or that they were getting the appropriate support, whether it be from a municipality or province.
We basically provide people with medical marijuana, recreational marijuana, and stuff that we should have been entitled to a long time ago. My dispensary is a community of people that need medication, and they don't have the means or the ways to get it. And basically they come to us and they get it, and we also provide for recreational purposes as well. At first I thought it would be more of a recreational, I'm not gonna lie, and then when you meet people and you hear their stories and you hear what you're doing for them,
We have a large swath of patients, whether it be younger students who have anxiety or going through depression, to individuals like myself who are more in their 30s who are just trying to use cannabis as a form of pain management as opposed to using, let's say, Oxycontin or opiates that were prescribed to them, to even older generations like my mother, who's a baby boomer, who uses it as topical creams to manage things like arthritis. We've really taken on, I would say, the challenge of getting the information out to various groups of different ages, of different genders, and really showing them that it's all about how your body reacts to cannabis, where you need to really identify either the delivery system or the application in which you need to use it for your own personal benefit.
I've always seen a role for dispensaries in some shape or form in the Canadian model, and for several reasons. One is that organically they've evolved alongside the cannabis culture, if you like. There seems to be a natural fit for a place to go to talk about cannabis. It's its own drug. It has a lot of pieces around it that are quite unique, and people want to go and talk and exchange ideas and be educated around cannabis. And the dispensary concept seems to meet that. There are people there who understand the plant, understand what it contains, and can talk to consumers about it, whether they be patients or otherwise. So there seems to be an important gap there that the dispensary fills. The problem, of course, is that under existing frameworks, they're not legal. So there's a limit to how much we can say about what kind of quality there is. What is the information that's being shared? What is the quality of product that's in those dispensaries? And I think that's something which needs to be addressed before we can see a role evolving under a new regulatory framework. There are lots of different ways to consider retail, but I think the dispensary movement was important in showing that people needed and want to have a place to go. But I suspect that with the advent of online sales and online retail, that it's going to be very interesting to see whether people do in fact need to go physically to a shop to look at, talk about, and examine different products when they can do so much of that online and it's safe and secure. So I think it's going to be very interesting to see the future of the dispensary concept.
Unfortunately, the way that things are playing out, I don't necessarily see medical dispensaries existing after legalization is rolled through, because C45 and then the provincial counterpart 174 make it very explicit that, at least from the onset, it will just be the government-run stores. Right now, it is high barriers of entry to become a licensed producer, because it does take several millions of dollars, and you have to meet certain security requirements to then do so. And unfortunately, organizations like ourselves, it is hard to play in that space, because we right now, although municipally in Vancouver have license and they acknowledge the work that we're doing within the community, federally that's still seen as an illegality. Whether it's a medical dispensary or a dispensary that just sells cannabis and isn't trying to assist, medical patients, there needs to be, one, greater access, meaning more of them, and then two, regardless if you're catering to recreational or medicinal consumers, there still has to be that education piece, because anybody that's consuming cannabis, whether they, are using it medicinally or not, they need to realize that their body is using it medicinally.
Well, there'll always be a dispensary, right? Like I said before, that, if the LCBO were going about it the right way, with the right channels and letting the people have jobs, letting, dispensaries operating and maybe putting a tax on us in some way, that could work. But trying to completely shut us out, all they're going to do is create more of us. The government doesn't know about cannabis, but Canadians know about cannabis. If they don't wake up and see that dispensaries are a good thing, then they're just going to fail even more. You can tax it and probably make the same amount of money, if not somewhat close, if you had dispensaries and give the people in the country jobs. They need more time to plan, and they need to let people get their means of medicine. Let dispensaries operate, let us register, let us tax us, whatever is fair, and let the people get their medicine and get their recreational use until you are ready. You are not ready. You're not talking to the farmers of the best buds that are in Canada. You're not learning what makes people, happy on the recreational side and satisfies the medicinal needs. Because if you were, you'd get it right. You just think you're going to push whatever product in front of Canadians. They don't want the commercialized stuff that's been grown by the mass. And if it is grown by the mass, they want the guy that started with that, has been farming that for a significant amount of time, to come and tell you what you need to do. Not your science and your numbers and to get the THC capped and underneath this amount. No.
To be quite honest, we will not be trying to fight the government after that legalization date, because the issues that will arise thereafter will make it harder for us as an organization to be able to engage them. And we want to be able to engage them in a manner where they see us as, a thought leader, They see us as, a trusted source of information and knowledge and experience within the community and within the cannabis industry. So coming as we get closer to legalization, where we would be looking at dispensing would be in jurisdictions where we have sought out licensing. And then for jurisdictions where we don't, we would be, again, like I'm saying, repositioning ourselves to engage government so that we can open the doors to legalization thereafter.
Dispensaries. What a word. And it really has taken to the cannabis industry with the word dispensary. So that's basically a storefront where cannabis is sold totally illegally, that insofar as that you are not able to walk into any storefront location and purchase cannabis legally. Full stop. So it's of suspect origin, it's of suspect cultivation practice, and there definitely is not a certificate of analysis on the God level Rob Ford Bubba Kush green crack that you buy at your corner store, because that is a completely different, that's an illegal operation. And so it's sort of fascinating to see how, using the word dispensary in the same breath as MedRelief, that we haven't done a good enough job of sort of differentiating how we operate versus how those dispensaries on the Danforth, which have no sort of supply chain checks and balances or quality control processes. MedRelief has a license to grow cannabis from Health Canada. So every gram that we grow is vetted from a quality perspective, is vetted from a product safety perspective. We do exhaustive testing to ensure that there are no aflatoxins or corrosive materials in the cannabis that we sell, to ensure that the product safety and product quality is part of the medical process for the patients who receive our product. I just think that if Canadians understood the difference between the legal market, in which MedRelief is a participant, and the illegal market, there would be a much faster uptake and a departure from the black market and how it operates currently, and the dispensaries being the primary sales channel for the black market. If you're not dealing with a licensed producer who has a license that you can search on the internet, you're not dealing with the legal market.